Hyper and hypothyroid disorders are the two most common disorders that originate from a malfunctioning thyroid. Today, we are diving into a topic that affects millions of people worldwide, thyroid disorders. The thyroid gland, it really plays a crucial role in regulating your metabolism, giving you proper energy levels, as well as affecting all the other hormones of your body. So when your thyroid malfunctions, it may be small, but it's mighty, and it can lead to a significant number of health issues. So stick around for the next 10 to 15 minutes and we'll review the most common thyroid disorders. We're going to talk and explore 4 different ways to address and potentially cure thyroid problems for good. So get this, in the United States alone, an estimated 20 million people suffer from thyroid disorders, with a staggering 60% of people being unaware of their condition. So that's over 12 million people living with a potentially debilitating health issue, unaware of what's brewing in their body, maybe thinking that this is their new normal, or constantly asking questions, maybe going to the doctor and saying, I just don't feel good. And the limited number of panels that are being done are normal. So the patient thinks that they are crazy. Maybe they feel like a chronic complainer and they start to accept this as their new normal. And the 60% of people that are on standard thyroid medication typically continue to experience symptoms with thyroid because the root cause with any of the thyroid medications isn't truly being addressed. So to really dive deeper into thyroid disorders, that thyroid gland, like I said, it's small, it's mighty, it's located in the neck. It produces those hormones that regulate metabolism, help with energy. And when it becomes overactive, that's called hyperthyroidism. When it becomes underactive, that's called hypothyroidism. And it really disrupts this delicate balance of hormones in your body. Actually comes from autoimmunity. Things like Hashimoto's for hypothyroidism, Graves' disease for hyperthyroidism, where what's happening in these cases is that the immune system mistakenly attacks the thyroid gland. Well, if you and I were attacked, we're not going to function optimally either over time. So let's talk about step 1. I don't want you to try to make all of these steps in one day. I want you to find one thing that makes sense to you to develop or to add in to your lifestyle that you can continue to do. Because the point isn't to try to get healthy. The point is to stay healthy. The point isn't to make some sort of change. The point is to keep the change. Lifestyle and consistency is where your power is at. So first and foremost, when we talk about lifestyle, this really can have such a profound positive impact on thyroid health. And a balanced diet is key. It's not about being perfect. It's about focusing on whole foods that are rich in things like iodine. So seaweed, seafood in general, selenium, which can be found in Brazil nuts, sunflower seeds, and zinc is also really important. That can be found in various meats, shellfish, and legumes. Now, if you feel like you're struggling and you're like, there's certain foods I can't eat or I have trouble with those, hyperthyroid, it kind of speeds things up. It can lead to things like weight loss, rapid heartbeat, even anxiety or nervousness, while hypothyroid, which is more common, can lead to things like weight gain, fatigue, depression. It kind of slows everything down. So often these disorders, their root cause, that may be that your case is one that would just be better kind of worked on or communicated through with a practitioner that can help you determine best foods for your particular case. But those foods can help in general. Now, also regular exercise. Your body is meant to move. Your brain needs you to be moving. It's kind of like an energy wheel for the brain. We've got to have movement in the body for the brain and the body to be healthy. And you don't have to take on a half marathon. You don't have to do CrossFit or something like that. Simple things like a brisk walk, yoga, it can support the metabolism. It can positively manage stress, which ultimately those things are going to have a huge influence on thyroid function. Now, number 2, herbal remedies and supplements. There's a lot of things out there. I would encourage you, don't just start Googling and start to take every single thing that you can find on the internet. There are certain remedies, herbal remedies, there are certain supplements that can complement your lifestyle changes. And some really common ones that are usually pretty good are things like ashwagandha. It's an adaptogenic herb that really helps to balance hormones and reduce stress. Bladderwrack and kelp are rich in iodine. It supports thyroid function. However, it really is crucial to consult with a healthcare practitioner before incorporating these supplements into your routine, especially if you are on medications, because some of these can interact with medications and therefore affect your thyroid level. So I'd really encourage you, whether it is supplements, don't dive too deep into those, or definitely don't start changing your thyroid medications without having a practitioner guide you through that. So number 3, thyroid thyroid supportive nutritional changes. When you really dive deeper into nutrition, not only is it about adding things into your diet, but can also be about avoiding things that are going to wreak havoc in the body. So what we know for sure is processed foods, it doesn't matter what the health condition is, processed foods are harder to digest, they're harder to detoxify from, they put a stress level into the body. So really making sure that we're avoiding as many processed foods as possible. And then your really key thing would be to reduce gluten soy intake, because it can benefit thyroid health, especially with people that have gluten or soy sensitivities. And you don't have to guess with that. Like, you can test and determine exactly what your sensitivities are, including the sea vegetables like seaweed that I mentioned. What that also does is provide really essential minerals, things like iodine, which are vital for thyroid hormone production. So a fun meal idea might be something simple like a hearty salad with mixed greens, nuts and seeds, or a seafood stir fry with kelp noodles. Number 4, medical and professional guidance cannot be overlooked. We need to seek medical guidance for a comprehensive approach to thyroid health. It is not a cookie cutter approach. It is not a one-stop shop for everybody. There are different things that can affect your thyroid. Your adrenal glands can affect your thyroid. Your reproductive hormones like estrogen and progesterone can affect your thyroid. And if we start to just go down one path and we're like, we're only going to look at thyroid numbers, we're only going to take iodine, which please don't do that either, but iodine-rich foods, but don't start taking high doses of some of these things without somebody guiding you. But if we're just looking at things like this through a tunnel vision and saying this must be the problem, and we don't look at your body as an ecosystem, we could be missing something. So if your current healthcare or regime when it comes to your thyroid health is that you are simply looking only at thyroid, again, something else could be missed. So make sure you're seeking some medical guidance, professional guidance, a functional medicine practitioner, ideally, that it really does look at your body like an ecosystem and knows that all ththose systems of the body intercommunicate and affect each other. So depending upon your current condition, again, the treatment can be different. Sometimes we need thyroid hormone replacement. But again, if you are only addressing the thyroid hormone replacement through things like Synthroid or levothyroxine, you could be missing the root cause, because those things do not address things like autoimmune disorders. So again, we have to look a little bit deeper. Severe cases, surgical interventions can be necessary. Our goal is always to avoid, to the best of our ability, avoid any medical procedures or medications if we don't need them. But there is always a time and a place for that. And that's where a really qualified professional can help you develop a tailored approach to your thyroid health. So, okay, to wrap it up, I want you to remember that addressing thyroid health requires a holistic approach no matter what. So even if you are using medications, you are addressing autoimmunity through your endocrinologist, your primary care, another practitioner, we have to look at this holistically as well, because diet, lifestyle, stress management, things like exercise, nutrition, proper supplementation, they all play a crucial role. And when you look at thyroid and really any problem in the body, you have to kind of have a lifestyle suitcase that you bring out, you open up, and it doesn't have to be complicated, but it does have to be consistent. So any changes that you're making for your body, again, the point is not to get healthy. The point is to stay healthy. The point is not to get in shape. It's to stay in shape. So we want you to get your quality of life back, your width of your life, and then help you protect that over time. So please choose one thing, start to implement these steps today to really take charge of your thyroid health. If you have any questions about that, if you need some guidance, you are more than welcome to reach out to us directly through our website. You're welcome to comment below. You're welcome to give us a call. And please, if you do find this video helpful, there are so many people that are suffering needlessly. So please like, comment, subscribe. Thank you for watching today. I wish you nothing but the best of thyroid health and happy hormones. Have a great day.